Hello everyone, welcome to live session. Very important live session, and I think well in demand, talking about the very recent recall points. Questions recalled from the last exam, which was considered to be one of the very different patterns exam. And today we are going to analyze that completely, how that exam was different, or was it also the same but with more depth. That is what we are going to discuss today. So here is the session most asked for 15 tricky questions from January 2026. So here we go, and I welcome you all on this afternoon once again. And I think we will be live almost every Saturday, so please do keep joining every Saturday at 4 p.m. Usually you will find a live session at our channel. So hello everyone. So here are a few people who have joined. Great to see you all. So Dr. Suganya, Dr. Deepti, and Dr. Maim and Dr. Swati, Dr. Alpana. Good evening, very good evening. And many of my lovely students from the course as well. I can see them here. And also some new faces and new names. So happy to have you all here from across. So today this session is important for July 2026 students because you are going for the exam. You have very less days, so you exactly need to know where to focus. But it is equally important for January 2027 because this is the right time when you make your search and choose a right path for the next success. And for the January 2027, I do have a very special strategy at the end, which I'm going to discuss. So if you are a January 2027 student, do remain till the end to listen about a best strategy for you to cross your part 1 and part 2 in one go and save your time and money as well. And for the July 2026 students, every questions from we are going to cover today is very important because the same questions appeared in the last exam and they can appear in the next exam as well. And you need to know like whether you are focusing on the right topics or not. So here we go and we start. And I will be looking for the answers in the chat box. So please keep answering in the chat box. And of course, you would like to have your name announced as the fastest finger first as well. So that's a great opportunity to have your name here as well. So I'm waiting for all the answers coming on in the chat box, and I'm having an eye there. So please, let's go and let's start. So these are 15 tricky questions, and simultaneously I will also let you know like what is the topic which needs to be covered to solve this particular question. What actually you should go and read. So what's coming up today this afternoon? 8 conceptually tricky questions, classic exam traps from January 26. Read the stem twice. Why it is important to carefully read your questions. 7 controversial questions which may have different answers around, and you still need to focus on the right answer. So I have divided the question like how the RCOG gives you at a different difficulty levels because okay, so here comes a very important point. Do you know that in RCOG exam, every question does not have a 1 mark. Different difficulty levels have different marks, okay? So if you did not knew that, then this is the first time you must have heard that. So live discussion and question and answer. You are welcome to ask all your questions in the chat box, and I'm here to answer all your questions. And then, as I said, high yield strategy for the last 6 weeks for July 2026. And I will not forget the people who are going for the January 27. There is a great strategy for them as well. So here we go. Let's start. Let's start from the first number question. Mebris 2025 is always a very favorite topic, or not just 2025 means a Mebris. So that is basically the data of the near miss and the mortality cases in the UK. So that is what is discussed in this. It has always been a favorite topic of RCOG for the part 2, but this time the question appeared in the part 1 as well. So what is the UK maternal mortality rate per 100,000 maternities? Let's see who knows the right number. I think the students from the course should answer that because we have covered this in the course. So you must be knowing that. Yes, that's what I was thinking. Some of my course student is going to answer is right. And yes, but I'll wait for a few more answers to come up in the chat box, and then I will answer the right thing. So we have A option, we have D option. Yes, quick. See, anybody could get the fastest finger first. So why not? Everybody be active. See, you will cover 15 questions of your exam. You can be pretty sure that among these 15, you will have 5 to 6 in your exam. That's going to be there. Yes, there's another question option of A. So yes, A is the correct answer here. A is the correct answer here. Yes, very good. So many correct answers. So Dr. Deepti Khandelwal. She is the fastest per finger first. And that's the correct answer here. 12.82 per 100,000 maternities or 1 lakh maternities. Very good. So this is the correct answer here. So previously it used to be 13.56. So if you go and see the older recalls or the older PDFs, you may find the lower numbers. So you need to know the best and the updated data, and data here is 12.82 per 1 lakh maternities. Now coming to the next very important topic, gynae surgery, particularly the questions regarding the laparoscopy is a hot topic. You need to know the laparoscopic entry pressures for the primary report, for the secondary reports, and multiple things about that. So here is the one of the important question. During laparoscopy, the most commonly injured vessel during right lateral port insertion is a branch of which artery? During laparoscopy, the most commonly injured vessel during right lateral port insertion is a branch of which artery? Let me see who is going to answer first. AD. That's what, if you remember, I told you in the very beginning, we are going to take the questions where you have to, which are tricky traps, and you need to read the answer, read the stem carefully. If you remember, I started with this, that first 8 questions I'm going to take are the tricky trap. You need to read the stem carefully. And that's why the answers, I can see 2 options in the chat box, that is A and D. Because the most commonly injured vessel is definitely inferior epigastric artery. There is no other vessel, right? The correct answer for the question, if it has asked like most commonly injured vessel on the lateral port insertion, it is inferior epigastric artery. But did the question ask this? No. Question asked which is a branch of which artery. They are asking the parent artery of inferior epigastric artery. So the correct answer is external iliac artery. And that's why I can see equally A and D in the chat box. So basically D. Now what is the correct answer? D is the correct answer because the question is definitely is about the inferior epigastric artery, but the question is asking the parent artery. So this is a tricky trap, right? So it is important to read the question carefully. Now let me see who answered the D first. So yes, that is Dr. Khan Kakkar 8296. You have got the correct answer right and the fastest finger first. And unfortunately, the many people have answered A and now, but it's good that you have answered here because now you will not make this mistake in exam. And it is a very repeatedly asked question in exam. So very good. Here we go with there are other Ds as well, like Dr. Swati Dhingra, Dr. Asma Wasim, and Dr. Riddham, so Dr. Sumita, Dr. Meena. So there are others also who have written the D is, yes. Dr. Khan is first. Yes, I know that's the Dr. Khan who is first. Yes, Dr. Kanksha has also answered it. Right. Okay. No, it's not A. Unfortunately, this is D. So please correct this in your memories. So external iliac artery. The injured vessel is the inferior epigastric artery. The question asks for its parent artery. Which is the external iliac? Don't fall for option A. Read branch of which artery very carefully. The injured vessel is option A and the parent artery is actually option D. Classic exam trap. Testing reading comprehension. They are not just testing your knowledge, but they are also testing like how vigilant you are. Want 100 plus such tricky case discussions? MRCOG courses is there to help you out. Okay, let's talk about the next important tricky trap. Let's come to the next important tricky trap. I hope you all are feeling interested. If you are, yes, put in a thumbs up in the chat box and I will know that yes, you are enjoying the discussion right now. Waiting for the more thumbs up. A woman with the abdominal pain has beta HCG of 155 milli-international units per ml. Repeated 48 hours later, it is 270. What is the most likely diagnosis here? What is the most likely diagnosis here? Thank you so much for enjoying the session. Yes, Dr. Art Khandelwal, Dr. Mariam. Yes, thank you. And what about yes, others are not enjoying or busy in answering, I think, probably. Yes. So, yes, what is the correct answer here? So, I can see A and B. And I know these are the two most confusing options in this. Because either it is ectopic or it could be normal intrauterine pregnancy. So, what is the rule we follow? See, there are three things to take care of. There are three things to take care of. There are three things which can happen in these scenarios. Let me put up some explanation for you. So there are three options we can find here. One is 66% rise, right? 66% rise. This is there. This is, then it is 50% fall, right? So that is more important. And one is between these two categories, right? So now what is it? So here we see that the fall is rising. And now we have to see how much it is rising. So if I calculate the rise here, this is 74% rise. And because it is 74% rise, so it is more than 66%. So what we can expect, this can be the a normal intrauterine pregnancy. If it is less than 50% fall, sorry, more than 50% fall, if it is falling and the fall is more than 50%, then it is failing pregnancy. It is going to be non-viable pregnancy. But anything between the two, that is the rise is there, but it is more less than 66%. The fall is there. There is 50% fall, but less than 50% fall is there. So this intermediate category is your ectopic. Now here it is 70% rise, so it is above 66%. So this is going to be the normal intrauterine pregnancy here. So B is going to be the correct answer. I hope it is clear to everyone. So 155 to 270, 74% rise in 48 hours, which is more than 66%. So it is viable. And suboptimal rise is the ectopic. Non-viable is 50% fall, more than 50% fall. Now the trap to avoid, many people picked ectopic. See, I've already mentioned that that's a trap and some of you unfortunately fell in the trap. No worries. You fell in the trap once here. This is much, much better than falling in the trap in the exam. So that's very good. So many candidates pick ectopic because the rise is positive, but not double. Examiners want you to recognize the suboptimal rise. So suboptimal rises there, but less than 66%. Remember the two very important figures here, 66 and 50. If you are rising, rise above 65 so that you are safely intrauterine. If you are falling, fall below 50 so that finally it's failed, done. Because in between is the ectopic, which is the most dangerous one. So again, tricky questions? Yes. Suboptimal, yes, Dr. Rhythm, the suboptimal is there is rise, but not 66%. It is less than 66%. Okay. So rise is there, but less than 66% is suboptimal rise. Similarly, if the fall is there and it is less than 50% fall, then it is also suboptimal. Okay. I hope that's clear. And who has answered the B first? B first. Okay, the B first is at the rate GSRI doc is the B first. After that, Dr. Sumita, Dr. Rhythm, and Dr. Meena, then Dr. Deepti, they have all have answered right as well. Dr. Swati, then Dr. Maim. So yes, Dr. Navya Rathore, so she has also answered right. And many of you have also given the thumbs up that they are enjoying. Dr. Earth, Dr. Mariam, and Dr. Sumita. So a lot of you are really enjoying the session. Thank you so much. What about molar pregnancy? See, molar pregnancy cannot be predicted by the rising or the falling pattern of HCG. For molar pregnancy, we need to do the ultrasound. First line is ultrasound. Once ultrasound confirms that, then later on, after removing the products, gold standard is histopathology. For definitely there is excessive rise of the HCG in the molar pregnancy, but there is no such differentiating point because twins may also have an excessive rise. So for molar pregnancy, it cannot be predicted from the beta HCG titers. It has to be diagnosed by the ultrasound. Okay. Oh, many of you have already answered the next question as well. Very good. So this is a primigravida at 36 weeks has a static symphysis fundal height of 32 centimeters at 2 consecutive visits. Now the growth is stuck and you can have a growth chart here actually. We have actually, in our class, we have given a growth chart also about it. So that can be there. So what is the most appropriate next step? What is the most appropriate next step? Now, in this question, you are looking at the question like this, but this exam will have a growth chart and you will have to see that, okay, there is a plateau. That is very, very important, right? So how does your growth chart will look like? Growth chart will look like if the number of weeks are here and the growth is plotted here, this is number of weeks on this particular line, then initially it will be rising, 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 but then it will become the plateau. Something like this, you will see the growth chart, right? And whenever there is a static growth, then what happens is the growth scan with umbilical artery Doppler. See, symphysofunnel height gives you an idea, but then you have to confirm it. So growth scan will confirm it and umbilical artery Doppler will be the next step to look for what needs to be done here. So the option C is very, very, very correct by everyone. And the first person to answer is Dr. Earth Khandelwal. Earth Khandelwal, that is the first person, fastest finger first for this question. After that, Dr. Sumita, Dr. Meena, Dr. Meena, Dr. Meenakshi, and Dr. Deepti, Dr. Kanksha, and many, many others have answered it right. Okay. So what about the threatened abortion? If you are talking about the HCG levels in threatened abortion, then you have to see that HCG is a diagnostic factor. We use HCG as a diagnostic factor when we cannot localize the sac. In cases of pregnancy with unknown location, we use the HCG as a diagnostic factor. For rest all, we use ultrasound as the diagnostic factor. And what is threatened abortion? Threatened abortion, you have to have the fetal heart. And then there is spotting. Okay, the baby is alive and there is a spotting. That's what threatened abortion is. So that means the baby is alive, fetal heart is there. So you are looking at the fetus in the ultrasound scan. So no role of HCG monitoring in that. Okay. So that's the thing here. Yes. Now going on to, so the exam learning point is growth scan with umbilical artery Doppler. RCOG states that if the single measurement is less than 10th, then urgent growth scan with umbilical artery Doppler should be there. And always confirm with imaging before changing the management. SFH alone has very less sensitivity. Now, this is about the pharmacology. You know, the drugs and their effect on the breastfeeding mothers is a hot topic for example. Always you will get a question out of it. Which of the following analgesics is generally avoided in a breastfeeding mother? Which of the following analgesics is generally avoided in a breastfeeding mother? So which one? Like paracetamol, ibuprofen, naproxen, aspirin, and codeine. Which one to choose here? Okay. Is it C, C, C? And what about the... So codeine is usually not preferred in the lactating mothers, right? Codeine is usually not preferred in the lactating mothers. But the problem is they have given you a tricky this thing, right? They have given you a single dose. You are not giving it routinely. So that makes the difference here. Naproxen is a second best answer. Naproxen is the second best answer, but the main is aspirin. If aspirin is not in options, then the next best is choose naproxen. And that's how they play with the options. And that is why it is very important to see that, right? Now here, if you look at this particular sequence, there are three drugs. This is a tricky trap again. There are three drugs. Codeine, not preferred in the breastfeeding because that will lead to respiratory depression in the baby. Aspirin, Ray's syndrome. Naproxen can be given for the short duration but not long duration, right? So your choice ideally should be like codeine, aspirin, and then naproxen. But because they have given codeine only single dose, so that goes out and aspirin becomes the best answer here. Yes, I can see some of the students who have answered it right. So Dr. Khan has given the fastest finger first, followed by the Dr. Archie Sinha, that is the another person. Rest all have answered E and C. So very important, aspirin and regular analgesic doses is avoided. Risk of Ray's syndrome in infant is there. Paracetamol and ibuprofen are first line. Naproxen is acceptable short term. Codeine single dose is generally safe, but CYP2D6 ultra rapid metabolizers risk neonatal opioid toxicity. Then key teaching point is paracetamol preferred, followed by the ibuprofen, then naproxen with caution, codeine, avoid aspirin, all opioids long term. So therefore, it is important to choose this and be careful about it. Now, another commonly asked question, but again a tricky trap. So what is the most common cause of Cushing's syndrome? Now the question is, remember, is about the Cushing's syndrome and not the Cushing's disease. And this is the biggest trap here. So we are talking about the Cushing syndrome and not the Cushing disease. So who is going to pick up this first? Pituitary microadenoma or the iatrogenic adrenal carcinoma, and ectopic ACTH from the small cell lung tumor. So here we go. Very good. So that is B. B is the correct answer here and not E. Because not A also. See, again, the B is the commonest for Cushing syndrome. Cushing syndrome, we are talking about the glucocorticoid production, not the ACTH production. When we talk about the pituitary microadenoma, that's the commonest cause of Cushing disease, and that's going to produce the ACTH, right? So we are not talking of that. We are talking about the excessive glucocorticoid. So excessive glucocorticoid, the most commonest is people take steroids. So iatrogenic administration is the most commonest one. So that's there. And who is the fastest finger? Dr. Sumita Mathur once again, right? Once again, our course gem. So you have won it again. And Dr. Meenakshi and Dr. Meena. Yes, Dr. Durga, Anusuya, Dr. Deepti, Dr. Khan again, and Dr. Mariam, she got confused. Oh, no worries. You can learn now. No worries. Dr. Ridham. So many correct answers here. Okay, so this is iatrogenic exogenous glucocorticoid administration. Explanation is Cushing syndrome, any cause of hypercortisolism. The most common cause is iatrogenic. If we talk about the Cushing disease, then that is the endogenous cause. That is where the pituitary comes. Okay, so this is the most important thing here. Now coming to another trap. What is the embryological origin of trigone of the urinary bladder? What is the embryological origin of the trigone of the urinary bladder? Mesoderm, endoderm, ectoderm, metanephros, or splanchnic mesoderm only? Oh, yes. Okay. So who's answering? Okay. So I think this is not for this particular. Yes. So B and A, B and A, B and A. So remember, see, whole of the bladder lining develops from the endoderm. Whole of the bladder lining develops from that is urothelium, that develops from the endoderm. But trigone is area which develops from the mesoderm, because it develops from the lower ends of the mesonephric duct. They get absorbed and they form the trigone. So this is the best answer here. So A is the correct answer here, and A and B. Therefore, I find A and B options here in the chat box, because some of you are choosing mesoderm and some of you are seeing that because that is the whole of the bladder is formed from the endoderm, so that it is also going to be formed from there. But no, this is a point here. And RCOG selectively picks up these points to ask those questions. Whenever there is any exception, RCOG examiner is going to crawl there and pick up that exception and bring that on your exam question. So all exceptions are your exam question. So similarly here, the bladder is formed from the endoderm, but the exception is the trigone, which is the mesoderm, right? So A is the correct answer here. Let me see who has answered A. Is this Dr. Sumita? Yes. Again, once again, Dr. Sumita here, then Dr. Khan, Dr. Earth. So all of you have done it right. Very good. Okay. So that is the mesoderm is derived from the absolute mesonephric ducts. Okay. Both A and B are important, but B is the most important one. So that is there. Okay. Now coming to the next tricky trap, the last tricky trap. After that, we are going to have the 7 questions who have controversial answers. So here is the last tricky trap. Apart from the hypothalamus, the principal source of GnRH, non-CNS, because we are not talking about the hypothalamus. So non-CNS source, physiologically active in pregnancy is what is there? So what is there? So that is the yes, who is going to answer that? Who is going to answer that? Yes, so B is the correct answer. Perfect. So B is the correct, no, not B, right? Sorry. No, it's not B. It's not B. We are here, we are having the small intestine, pancreas, duodenum, pineal gland, and adrenal cortex. I think I have not got the answer for this question yet. So anybody who's going to answer this question, what is the correct answer here? Apart from the hypothalamus, we can have the GnRH from which source? We can have the GnRH from which source? So that is there in the, yes, that is there in the duodenum. C is the correct answer here. So that is there in the duodenum, and C is the correct answer here. C. In the last question, the duodenum and the placenta, two very important answers. Sometimes you may not have duodenum, you have the placenta. Sometimes you have the duodenum, so be very careful. Placenta and duodenum. These are the two extra CNS sources from which you can get the GnRH there. So that is there. Okay. Now coming to the next, that is controversial answers. So how many genes? Why I say controversy? Because the usual recall PDFs, they have the different answer here. So sometimes students, they learn up the wrong answer. So that is what we are going to discuss right now. So how many genes are encoded? How many genes are encoded in the human endometrial genome? So, how many genes are encoded in the human endometrial genome? So, what is there? Yes, yes, yes. Genes are encoded in the human. So, yes, yeah. So, what is the correct answer? Yes, C is the correct answer. Perfect, perfect, perfect. So, C is the correct answer here, and 37 genes is the perfect answer. The next question is about a gynecology, the routine scenario in the gynae OPDs, and that's why the RCOG's favorite. Which prostaglandin is the principal mediator of pain in primary dysmenorrhea? Which prostaglandin is the principal mediator of pain in primary dysmenorrhea? So the correct answer, oh, very good. So quick answers. It is B. Yes, very good. Dr. Durga Anusia, that is B. B is the correct answer. PGF2 alpha. That is the one which is responsible for the pain. PGF2 alpha is the principal pain mediator, causes intense myometrial contraction with ischemia, and this ischemic pain is there. PGE2 contributes to vasodilatation and sensitization, but PGF2 alpha is dominates. Now, that reminds me of another important question, like what leads to endometrial shedding? What leads to what pathological or what process leads to the endometrial shedding? So that is ischemic necrosis. Ischemic necrosis, that is also another exam question. So this reminds me of the another thing, like here we have talked about, there needs to be myometrial contraction, ischemia, and the ischemic pain. So ischemic necrosis is the mechanism behind the shedding, and this is another important exam question. Okay, now another important topic of embryology, which is the brachial arches. Brachial arches. Which structure is derivative of second pharyngeal branch? Which structure is derivative of second pharyngeal branch? So here we go. What is there? So for second pharyngeal branch, my way of remembering is just remember everything starting by S. Everything starting by S. So what is starting by S here? Stylohyoid. And how we can remember the lesser cornu of hyoid? Take it as a smaller cornu of hyoid, right? So as I said, all S, everything S. So stylohyoid muscle and smaller cornu of the hyoid. So that makes it easy as well to remember this. So C is the correct answer here, and so many correct answers. Dr. Sumita, Dr. Rudham, Dr. Deepti, Dr. Khan, so Dr. JSI Doc, Dr. Earth, Swati, Dr. Swati, Dr. Meena, Dr. Durga, Dr. Alpana. So all got it right. So this is what it is, stylohyoid muscle and the lesser cornu of the hyoid. Okay, now coming to the biophysics, another tricky topic, but yes, with our collection, it is very easy. So radiation physics, radiation resistance, which of the following cells is the most resistant in the human body? Which of the following cells is the most resistant in the human body? The most resistant is the okay, so let's see who's going to answer that. Yes, E. Yes, mature neurons is the most resistant. If you do not have that in option, next best is the immature ones, because nervous tissue is the least sensitive, that is most resistant. So mature neurons is the correct answer here. Mature neurons is the correct answer here. Let me see who has answered as the fastest finger first. So mature neurons is Dr. Sumita's answer, and that's the correct one. So mature neurons is a correct answer here, and that is the most resistant. And if you want to study biophysics in only 50 questions, then we have that very interesting set of questions which you can just solve and get it right. So here we go with this particular thing. So mature neurons are the most resistant, and that is why it is important to go with that. Okay, now according to the FIGO classification of leiomyomas, what is FIGO type 7 fibroid? According to the FIGO classification of the leiomyomas, what is the FIGO type 7 fibroid? What is the FIGO type 7 fibroid? Type 7 means totally outside. Totally outside. It is just hanging. It's just hanging. So it is the subserosal pedunculated one. Subserosal pedunculated. Submucosal, no. It is subserosal pedunculated. So D is the correct answer and not the E. And that gives you the best answer here. So who has answered it right? Dr. Steffi, Dr. Meena, Dr. Densi, Dr. Alpana, Dr. Archisana, Dr. Durga. So many of you have answered it right. So remember, type 0 is pedunculated submucosal. It is lying inside. 1 to 2 is submucosal. 1, 3 is there, which is basically intramural, but it is coming onto endometrium. Type 4 is totally intramural. Type 5 and 6 is subserosal, but it is still slightly into the intramural. 7 is totally out. And 8 is the cervical and the parasitic ones. Okay, here is another one. Which laboratory technique is used to detect specific RNA sequences? You will find this question in more than 90% of your papers. Mark this question. I have told you out of these 15 questions, at least 5 to 8 you will find in the exam. So once you see those questions there, remember me and bless me as well, because you will get those answers right. So that's going to be there. These are I've chosen a very high yield 15 questions for you all. So what is this basically? Yes, Dr. Deepti got it right. This is the northern blot. Very, very, very important. RNA detection uses DNA. Northern blot is for RNA detection. Southern blot is for DNA. Western for protein and Eastern for post-translational modifications. How will you remember? Remember the mnemonic, snow drop. Snow drops, okay? So S, snow, gives you DNA. N, snow, after S comes the N. So N will be RNA, right? And O will be O, and P, Western blot is the P, right? So snow drop. Remember this as snow drops. And that's how you can never forget. Otherwise, this is confusing. Like people think about like where Eastern, where Western. So if you remember by snow drop, S, D, N for R, and then W for P. So snow drop, very, very, very interesting way to remember that. Need more interesting mnemonics? MRCOG courses is there to help you out. Okay, so last question for the today. Microbiology, Mycoplasma genitalium. Which is the following best describes the cellular characteristics of Mycoplasma genitalium? Which of the following best describes the cellular characteristics of Mycoplasma genitalium? Is it gram positive? Is it gram negative? It is gram negative Coccobacillus. It is gram variable, or it does not have a cell wall, so it cannot be gram stained. Or it could be like it has no cell wall, so it cannot be gram stained. So E is the best answer. E is the best answer. If E is not an option, then we can choose the D because gram variable. Otherwise, because it does not have the cell wall, so it is not gram stained. So E is the correct answer here, and Dr. Arth Khandelwal, Dr. Swati Dhingra, Dr. Deepti Khandelwal, and Dr. Khan once again, Dr. Jaisarai Doc, Dr. Vandana Shukla, Dr. Sumita, Dr. Alpana, Dr. Steffi, Dr. Archie, and Dr. Mimes. All of you got it right. And that's it. The smallest free living organism with no cell wall, so it cannot be gram-stained, is the mycoplasma. So it has no cell wall, cannot be gram-stained, so it can neither be gram-positive or negative, resistant to beta-lactams. Treat with the macrolides or tetracyclines. So that is the correct answer here. So what is the strategy for the last 6 weeks? As I told you, I'm going to give you the right strategy for the last few days. So 3 things that can move the needle in the last 6 weeks. Even if you have not studied anything till now, what you can do in the last 6 weeks. Frequently asked topics. Like in anatomy, what are the frequently asked topics? Ischiorectal fossa. More than 10 times question has appeared in exam. Iliohypogastric and ilioinguinal nerves, L1, more than 6 times this question has appeared in the exam. Bartholin superficial pouch, more than 5 times have appeared in the exam. Foregut, midgut, hindgut, their levels, their vessels, 5 times they have appeared in the exam. Umbilicus, T10, 4 times this question has appeared in exam. Pudendal has come 3 times. So the same facts are tested every paper. So these alone can bring you 25 to 30 marks, which can make a difference. So if you are looking for this kind of a preparation, like either you drill into the recall papers and bring in this kind of things for you, else you can have everything ready laid on the platter and relish it with MRCOG courses. Drill recall papers, but critically. So go into the recalls, but do not just remember the answer. Drill them, understand. You see that they change the options. They change the part of the question, and that changes the answer. So just knowing the answer of the recall is not enough. And if you are just looking at the question bank and just not looking at why it is so, what is the story behind it, then it's going to be difficult. So drill recall papers, but critically. Recalls show you the examiner's mind, but 10% of recall answers are wrong. Use recalls to spot patterns, not to memorize blindly. So spot it, right? So always verify with the correct sources from the RCOG or the NICE. Timed SBA practice, very important. Time yourself. How many questions you are able to handle in certain particular time. And that is why we provide you with the timed mocks, so that you exactly know like how much questions you are solving in that particular time. So this is important thing. So pass mark varies from 63 to 69%. Go consistently above 75% while attempting the mocks, right? So daily question practice, make it like 50 to 100 questions per day. That is what you require. And you won't be surprised that with practice, within a week, you will solve this 50 questions in 1 hour. And if you want that kind of a practice, then a lot of worksheets and recall worksheets are available with the MRCOG courses. So join the next batch, ensure your success in 70% less time. If you are a July 2026 batch, then the fast track 6 weeks program is there. Definitely, we have still the enrollments going on. So please do come and enjoy the platter, and you can easily score well in the last 6 weeks as well. So you are delayed, but you are not out of time, right? Still, it's a time to catch hold of the last 6 weeks. This is the QR code to sign in. And for the July batch, right? For the July batch, it is an offer. We don't offer discounts. That's an offer which I'm going to put up right now. That is part 1 and part 2 combo with excess till pass. This is the best thing to go for July 27. Because as you see that the questions are not coming very superficially, right? So you need to know the concepts bit in depth. So why not take advantage and start reading for part 2? And once you start watching the videos of part 2, you are going into the bit more depth as compared to the part 1. And secondly, because you start with the obs gynae and that's your domain, so it becomes very easy to go into the flow. So you have 3 benefits of doing this. One is you are saving your time. How? Because you are reading for part 2 here. So by the time you cross your part 1 in January, you are almost 70% prepared for part 2. So within a 4 months, in next July, you can clear your part 2. So this is how you can save your time. Secondly, you can be better prepared for part 1 because many things, they are coming more explicitly in the part 1. They need more detailed, more intense things. So intense yet comprehensive preparation you can do with this combo plan. And third thing is this will make your preparation more palatable, more interesting, because obs and gynae, which we all love because that's our subject, and that makes us easily go towards the other subjects as well. So with three advantages, if you really want, and the fourth one, which I really don't want to mention, but it is there, is you have a financial benefit also of almost INR 10,000 rupees. So part 1 and part 2 combo with Existal Pass is the best thing you can actually gift yourself this Mother's Day. So intense yet comprehensive exam prep in 70% less time. Like, subscribe, and comment your doubts below in the chat. And if you have any questions, I'm still here to answer those questions. And you can just take the screenshot and keep the numbers. If you have any more doubts, we'll be there to answer them all. And ensure success in 70% less time with MRCOG courses. I hope you all loved this session. Would like to hear your feedback in the comments. And do leave. And if you want any particular subject to be discussed next time, in the next live session, please do put in here. I'll certainly take that next subject in the upcoming weeks. Okay. So any feedbacks, any questions, they are all welcome. Thank you so much for joining you all. Such a lovely audience, and many of whom are students and many of the others as well. So yes, thank you for the thumbs up. It was a superb, ma'am. Dr. Vandana, Dr. Sumita, Dr. Mariam, thank you so much. Thank you so much for joining in and staying till the end as well. Yes, Dr. Khan, very nice session. Thank you. Thank you, Dr. Mine. Thanks. Thanks everyone for joining. And do let me know what is the next important thing you would like to discuss here. Yeah, thank you, Dr. Deepti. Okay, bye-bye. Take care, everyone. And we'll meet again in the live session. Thank you.